Could someone from a country like Canada explain free healthcare?
All right, I'll try. So we pay through our taxes. Simple as that. Everybody pays into the taxes, so everybody just goes to the hospital and uses it. I actually find it really funny that like Americans think it's a political issue, because it's not a political issue. Your healthcare is a for-profit organization, and they pay your politicians to lie to you about our healthcare. No one's waiting for things here. Like, you go to the ER, you wait for a few hours. Yeah, but that's if you're non-life-threatening injuries. If you go in there and you're bleeding from the ears, you're getting seen right away. In terms of surgeries, nobody waits for dangerous... Like, you get in a car accident, you get surgery right away. I had to wait 1 week for an elective surgery on my shoulder. 1 week. And guess how much I paid? Free.
Understand your system has its faults, but please stop listening to people like Bernie Sanders and A.
Hey everyone, so this creator bashes Canada's healthcare system and then tells you not to listen to...
Hold on. She just casually dropped the most important line in the whole video, and then tried to walk it back. Your healthcare is a for-profit organization, and they pay your politicians to lie to you. That's not a conspiracy theory. That's just publicly available lobbying data. And then in the same breath, she says, don't listen to Bernie and AOC, the people who are literally pointing at this exact problem. It's like someone tells you your house is on fire, and you go, yeah, but don't listen to the firefighter, though. The cognitive dissonance is real, and it's not even her fault. She's been marinated in this messaging her whole life.
Bernie Sanders or AOC. But two things that I want to say is, one, Canada still has better health outcomes than the United States does, despite its issues. Two, Bernie Sanders and AOC, the Medicare for All proposal is nothing like Canada's system. It's actually just one single payer insurance. So it's kind of like your insurance company now, except it'll just be one single publicly owned insurance, covers everybody and everybody pays into. But side to side, comparatively, Canada's healthcare system is still better than the United States. Emergency care in Canada is actually significantly better than emergency care in the United States. Wait times to see doctors and especially to see specialists is actually longer. When you calculate the amount of people who wait because they can't afford to have healthcare services, you actually see an average of an extremely longer wait time than Canadians do, because so many Americans simply just don't go see that specialist because they can't afford it. The biggest problem in Canada is not necessarily the system itself, but rather that there is just a shortage of healthcare workers in Canada. The United States is suffering the exact same problem that's actually going to get drastically worse as boomers are retiring. That is the biggest threat to Canada's healthcare system and the biggest threat to the United States. But Canada doesn't have all of the issues associated with a privatized system that the United States has. To avoid this problem, Canada and the United States really needs, seriously needs to incentivize more people going into the medical field. I don't think that we should seek to replicate Canada's system, even though it's better than the United States. It's not drastically better. I think that we should look at France's healthcare system, because France actually, by all standards, has the best healthcare system in the entire world, that has the absolute best results, best services, lowest wait time, and a significantly longer life expectancy than Canadians and Americans. But again, Bernie Sanders and AOC are not proposing Canada's healthcare system. There's a ton of models in the world that we can learn from. And my very last point is that Canadians do not pay higher taxes whenever you calculate all the kinds of taxes that you pay, be it property taxes, income taxes, and sales taxes, and the other taxes out there. It's pretty close to the same. Canadians get way more social benefits out of it, whereas Americans get war. Having Medicare for all would be a pretty meager increase in taxes, because we already cover the most expensive portion of the population under Medicare. Having everybody...
Sis, this is the part that makes MAGA girls actually short circuit. When you explain it slowly, you are already paying more than what a tax increase would cost you. Your premiums, your deductibles, your out-of-pocket maximums, add that up for a year. Now compare it to what a Medicare for all tax bump would look like for your income bracket. For most working-class Americans, it's cheaper, not more expensive. The people screaming about socialism are literally paying more for less coverage right now, and the insurance company is pocketing the difference and laughing all the way to Capitol Hill. This isn't left versus right. This is math versus feelings, and feelings are losing.
Everybody under Medicare, covering people who aren't the most expensive parts of the population already covered, would actually reduce your costs overall, because the taxes you would pay would actually end up being less than the premiums and out-of-pocket expenses.
So I just watched a video where a couple was talking about how they had to have surgery and they live in America. And I just wanted to share because I live in Canada and my son has had many surgeries, and he's medically fragile, and because of such, he's had to have surgeries on different parts of his body. But he also requires many specialists, such as having 2 anesthesiologists in the room at all times. That alone would be hundreds of thousands of dollars in America. His latest surgery, he had 2 anesthesiologists, 2 orthopedic surgeons, 2 dentists. He had a audiologist, a hearing aid, like a speech pathology type of specialist to help with the audiologist, a vision specialist who was working to see if he had retina detachment, and he had some techs doing some photos of his chest, all while they were doing surgery. So there was also techs in the room. There was also assistants in the room. And all of that was free. All of that was covered by our Canadian healthcare coverage. The only thing that I had to pay for the entire time was my parking, my gas, and we stayed at Ronald McDonald. That was before we went to a surgery, so that was $10 for Ronald McDonald. But if we didn't stay at Ronald McDonald, I would have had to pay for my hotel room, and I paid for my food, because as much as I appreciate hospital food, I do not like hospital food, so I paid for my food. Those were the only things that I had to pay for. The entire surgical experience, the entire recovery process, all of that was paid for and taken care of by the government of Canada for my son. So yes, there are problems with our healthcare system, but I never have to worry about getting a bill, and I will never have to worry about remortgaging my home or becoming homeless because my son...
Okay, I need everybody to pause and actually absorb what this man just said. His son has had multiple surgeries, multiple specialists in the room simultaneously, 2 anesthesiologists, 2 orthopedic surgeons, audiologists, vision specialists, the works, and the only bill he got was $10 at McDonald's and some gas money. In America, the child's care would have financially destroyed that family. Like we're talking hundreds of thousands of dollars, potential bankruptcy, losing the house, and MAGA guys want to call that a superior system. He said it perfectly. His son gets to thrive because of where he was born. That's not politics. That's just humanity.
Requires medical care, and he can thrive in this world by living in Canada. So for that, I will forever be grateful that I don't have to worry about the next surgery and the next bill that we get.
Right now. Guess when it is.
She's made several videos about how Canadian healthcare can be very difficult to access due to long wait times for basic exams and tests like MRIs, CT scans, and standard healthcare appointments. In America, we have an access to care issue based on cost. In addition, in America, sometimes you also have an access to care based off of wait time, which I've personally experienced. So both of these systems have some major setbacks and major things that could be fixed. And I'm not sure which system is better per se. What I can tell you is that I wish we had a system that did provide care for the most people, saved the most lives, and was the most efficient. I'm not sure how that is or what that would look like, but I'd love to know what you think, because if you have the answers and the solutions to our healthcare system, please let us know, because if you don't, it's just rude to keep it to yourself.
So 2 days ago, I did a video about leaving Canada and coming to Mexico, and I got this lovely comment right here. Make sure you don't come back to our free Canada to use the healthcare system. Well, I just want to let you know the last year I've had 2 miscarriages. I have not seen a doctor in person once. Not once, not when I said I was pregnant, not when I had a miscarriage, not for a post-op, nothing. When I asked to see a specialist, it was a 6-month wait for a phone conversation. I don't know what that's going to do to when you see a specialist, but here's what some Canadians are saying about Canada healthcare. And I really think that most people think Canadians have great healthcare, but it's actually a really broken system where we have to wait months and months and months for good care. And I'd rather be in a place where I can actually pay for it and get care right away. If I need surgery, if I need any sort of treatment, I feel lucky to be here.
Looking at these other countries, the benefits are obvious. Beyond the fact that they literally cannot fathom the concept of medical bankruptcy, It's simply not true that these countries face things like longer wait times or worse quality care. While different countries have slightly different metrics, more people in Germany, France, and Australia can see a doctor the next day than in the US. 4% of Americans...
See, this is what I need people to screenshot and send to their uncle at Thanksgiving. The whole Canadians wait forever argument is the #1 talking point from people who have never left the country. France and Germany get people to a doctor the next day more often than America does. Next day, not next month, not next year, tomorrow. And Sweden and Australia have specialists available at double the rate that American doctors report. The wait time argument was built entirely off the British NHS, which has its own separate privatization problems. MAGA guys got handed one broken example and decided that applies to every single universal system on Earth. That's not analysis, that's propaganda, doing exactly what it was designed to do.
Wait 4 months or more for non-emergency surgery, compared to 2 and 0% in France and Germany. And doctors in Sweden and Australia report patients having a hard time getting specialized tests and care at half the rate than doctors in the US do. The whole wait times thing is BS, and usually based exclusively on the mess that privatization has made of the British NHS.
Okay, I'm sitting here with my friend Christina. She's a fellow Canadian who's also moved to Florida on her E2 visa, and she's going to give you her experience with the Canadian versus the American healthcare system.
So in April 2021, I was dealing with a number of symptoms after I had COVID. And so it took me quite a while to get an appointment with my family doctor, and once I did, I was sent to do some testing. So to do those tests took about a year. It was an MRI specifically. And once I did the MRI, then I was waiting for the appointment with the specialist. That took 2 years. So in total, I had been suffering for about 3 years. When I moved down here, I went and got a family doctor right away, and I was referred to a specialist and did all of the tests in the matter of 3 weeks. So what took me 3 years to accomplish in Canada only took me 3 weeks here.
So there you have it, folks. For all you guys arguing on my healthcare videos about how Canadian healthcare is so much better, we have real life experience here.
लोग बोलते हैं यूएसए बेटर है कनाडा से, और ये बिल्कुल गलत है। कनाडा में फ्री हेल्थ केयर सिस्टम है, जहां यूएस में सभी चीजें प्राइवेट इंश्योरेंस पे डिपेंड करती है। यूएस में सैलरी तो ज्यादा होती है, मगर इनइक्वालिटी भी ज्यादा है। दूसरी साइड कनाडा में इनकम डिस्ट्रीब्यूशन थोड़ी बैलेंस्ड है। सेफ्टी तो आपको यूएस की पता ही है, उसके सामने कनाडा के साथ कोई कंपैरिजन ही नहीं है। यूएस में वर्किंग आवर्स बहुत ही लंबे होते हैं और पेड लीव्स बहुत ही कम, मगर कनाडा में वर्क लाइफ बैलेंस थोड़ा बेटर है। इसीलिए मैं कहता हूँ, अगर इन्वेस्ट करना है, कनाडा से बेटर कुछ भी नहीं। अब आप ही बताओ, इन्वेस्ट कहाँ करोगे, कनाडा में कि यूएस में?
Are you American and wondering what is Canada's free or universal healthcare all about? Keep watching and make sure you watch till the end. I have a crazy story that might blow your mind. So Canada's healthcare is free in the sense that our taxes pay for it. So our taxes are generally higher than US taxes, and that accounts for the fact that we have a generally higher social safety net than in the US. So what is covered under Canada's universal healthcare? So this is from my new book, Your Move to Canada, which is all about Americans moving to Canada. Make sure you save this TikTok so that you could refer to this list afterwards if you're...
All right, so let's just actually break down what Canada covers, because Americans genuinely don't know. Doctor visits, hospital stays, specialist consultations, emergency care, surgery, all of it. Covered, you walk in, you get treated, you walk out, no bill, no negotiating, no prior authorization nonsense. Now, yeah, prescription drugs and dental aren't universally covered. That's a real gap. But most employed Canadians get supplemental private insurance through work that handles that, and that private insurance is a fraction of what Americans pay for their primary coverage. So you're getting the big stuff free and paying very little for the extras, versus Americans paying enormous premiums and still getting denied for the big stuff. Make it make sense.
You're going to be moving to Canada. So you'll see things like doctor's visits, hospital, inpatient care, specialist consultations. These are all covered. So if you have to go to the hospital, you need surgery, all covered. You don't have to pay a dime. But certain things like prescription medication, vision, dental care, mental health services, those generally aren't covered by our universal health care. For the most part, if you're employed, your employer will provide you private health care, and you may pay some of the premiums, or they may pay all the premiums, or you share the premium cost. It's generally not too expensive, and then these things are covered. So for example, I get like $10,000 worth of dental care per year covered, and I would never get through that. But generally, if you're going to walk into a hospital or walk into a doctor, and no matter really what the condition is, you don't have to pay anything out of pocket. You don't have to worry about going bankrupt. Now, I said I tell a crazy story. So 2 months ago, I gave birth to my first baby, a little boy. And when I was in the hospital and gave birth, I had to pay for absolutely nothing. But unfortunately, when he was around 22 hours old, they uncovered a really serious birth defect that he had. And I had to rush to the children's hospital. And I stayed there for 2 weeks in the NICU. He had emergency surgery. He was seen by all of the different specialists, the cardiologist, the urologist, all the ologists that you can name of, he was seen by them. And he had all the surgery. And he has 3 more surgeries to go in this first year. But guess what? I didn't have to pay a single dollar out of pocket, other than perhaps getting some snacks at the Safeway down the street. So that is really the beauty of Canada's healthcare. So yes, Canada's not a perfect country. And some of these doctor's visits, hospital care, it's not perfect. You might have to wait a little bit or a long time to be seen. But the thing is, you never have to worry about going bankrupt as a result of needing medical care. And for that, I'm very grateful for Canada. If you want to learn more about moving to Canada, specifically the financial and tax aspects, check out my TikTok page and check out my new book, Your Move to Canada, on Amazon. Bye!
When you vote in Alberta in the next couple weeks here, I want you to keep this bill and this number in mind, because this Twitter account, she's right. If you want privatized healthcare, this is what comes with it. I can't afford that. Can you?
ट्रम्प के अमेरिका से 100 गुना अच्छा है हमारा कनाडा कि अमेरिका में इलाज कराना इतना महंगा है कि लोग हॉस्पिटल का बिल भरने में ही बैंक करप्ट हो जाते हैं। वही कनाडा में तो हेल्थ केयर फ्री है। अगर एजुकेशन की बात करें तो अमेरिका में स्कूल्स और कॉलेज की फी बहुत ज्यादा है।
This is where it gets real, because he said something that cuts deep. Canadians can be nice because their government actually cares about them. Think about how much mental energy Americans spend just worrying about healthcare. Am I covered for this? Will insurance approve that? What's my out-of-pocket maximum? Can I afford this prescription? Should I even go to the ER or just tough it out? That's an enormous psychological tax that Canadians and Europeans literally do not pay. And people wonder why Americans are stressed and mean and divided, bro. You built a society that tells people to sink or swim and then act surprised when everyone's drowning.
जबकि कनाडा में एजुकेशन सस्ती भी है और क्वालिटी भी अच्छी है। अगर सेफ्टी की बात ना करे तो ही अच्छा है। अमेरिका में दिन दहाड़े गोलियां चल जाती है, पर कनाडा दुनिया का वन ऑफ द सेफेस्ट कंट्री माना जाता है। सबसे बढ़िया बात, कनाडा में पीआर भी मिल जाता है, जबकि अमेरिका में लोग 10 साल से वर्क वीजा पे है और पीआर और ग्रीन कार्ड का कोई ठिकाना नहीं है। अब आप बताओ कमेंट में, अमेरिका अच्छा है या कनाडा?
I grew up in Canada, okay? We have socialized medicine. And I'm here to tell you that this bullshit line that you get on all of the political shows from people is that it's a failure. The system is a failure in Canada. It is not a failure in Canada. I never waited for anything in my life. I chose my own doctors. My mother never paid for a prescription. It was fantastic. And I just got back from Vancouver, and I keep hearing this, like, Canadians are so nice. Canadians are so nice. They can be nice because they have health care. Because they have a government that cares about them. It doesn't say sink or fucking swim, pal.
Right.
Or you live in a box. Yeah. There are certain people in our society that need to be taken care of. There are people without as many opportunities that need to be helped toward those opportunities. There are people who are sick.
But that's the...
You shouldn't have to lose your home because your mother got sick.
I always like to remind people, particularly pro-life Americans, that when I gave birth in Canada, the only expense I incurred for all of my medical treatment, labor and delivery, including the postpartum care from my midwives, was the parking at the hospital.
I've been working in the healthcare field for 7 years. I'm going to tell you a couple things that I've seen insurance do. And I invite people to go ahead and leave your stories in the comments because I'm tired of people comparing our system to Canada. Denying IUD removal because it's not medically necessary when it causes infertility when it's in there for too long. Denying medication that their doctor recommended because the insurance says you need to try 2 or 3 other ones first. Denying orthopedic surgery because they need to go do PT when their doctor already said they're not able to. Denying life-saving treatment the night before the surgery. You guys always want to bring up wait times. It's about 4 to 12 months to get an appointment with your doctor. The difference between our systems is that we pay hundreds to thousands of dollars every year to an insurance god that will deny for no reason, leaving thousands of people bankrupt.
It's insane. You know, this is something I've talked about literally
probably
7 years inside the system, and she's listing denials like she's reading a horror novel. IUD removal denied, medication denied, orthopedic surgery denied, life-saving treatment denied. The night before, and MAGA guys still want to talk about wait times in Canada, at least in Canada when they say you have to wait. They're not also charging you $1,200 a month for the privilege of waiting. Here you pay massive premiums to an insurance god, as she called it, and that god can say no for literally any reason. No accountability, no appeal that actually works. Just denied. Good luck. This is the system people are defending with their whole chest, and the people exposing it are nurses and healthcare workers who live inside it every single day.
videos ago, yesterday, or the day before. It's insane. Over here in America, you, like she said, will have to wait months for even a basic checkup. I literally know people that have had to wait months for a basic checkup. But I mean, it's crazy because this is someone who actually works inside of the system telling you exactly how the scam works. If you haven't already, make sure to leave a like, subscribe, hype up the video. Let's get into it.
You're telling me if you are a Canadian and you have a child, you get almost $1,000 a month. A month to do whatever you want with. Whether it's feeding your child, whether it's clothing your child, whether it's you use it for your bills. Almost $1,000 a month compared to us here in the States where we're getting a child tax credit when we do our taxes once a year, whatever. They're getting it once a year, almost $12,000 a year. And if you have 2, 3, 4, there are literally Canadians that don't work, that have multiple children that literally rely on that baby bonus every month. They call it a baby bonus. Not only that, wait. I just found out in Canada, you don't pay for your labor and delivery. So you go to the hospital in Canada, you're in labor, okay? You're having contractions. You go to the hospital, you birth your baby, and then you stay overnight, and then the next day, $0. You don't get charged a penny.
Crazy.
I thought we were the land of the free.
We haven't been. Yeah, pretty crazy. I mean, Canada gives families $1,000 a month for childcare, and a lot of other countries do a lot of things similar to that too. And MAGA voters act like it's science fiction and it's non-existent, and we have it better over here. I'm just going to get to the next.
Donald Trump just said Canadians should want to be annexed by America for better health care, even though Canadians have free health care. Here's what he said at a press conference this morning, quote, "I would love to see Canada become the 51st state. The Canadian citizens would have much better health coverage. I think the people of Canada would like it," end quote. First of all, Canadians have universal health care, which is a foreign concept to us in America, but in Canada, Canadians' tax dollars actually pay for their health care. So Donald Trump is obviously incorrect when he says Canadians would have better health coverage in America, when in fact all that would happen is that they would lose their free health care and then would start getting ripped off by health insurance companies like the rest of us do in this country. Not to mention, Donald Trump has still yet to unveil his healthcare plan. So what exactly type of healthcare coverage would Canadians be receiving under your administration?
Nothing.
Finally, Canada is an independent country that has no interest in joining America. So please, Donald, leave them and their universal healthcare alone.
Respectfully, very much respectfully, and also disrespectfully too, because Trump wants Canada to join us, realistically, if you think about it, just so they can lose their healthcare. That's the pitch. Come on, Canadians, lose your healthcare.
And there it is, the most absurd political pitch in modern history. Trump literally stood at a podium and said, Canadians should join America for better healthcare. Canadians who have free healthcare. That actually works. The pitch is essentially, hey, come give up the thing that costs you nothing and keeps you healthy, and join us where you'll pay $2,000 a month and still get denied for your surgery. And the wild part is there are MAGA supporters who nodded along to that and thought, yeah, that sounds right. This is what happens when you've never left the country and you've been told your whole life you have the best of everything. Canada said thanks, but no thanks, and honestly, respect. Protect your healthcare at all costs. Literally.
My health insurance is $680 a month.
What?
Mine's like double that.
What?
That's pretty standard.
And then that covers, like, then everything is free? Or
Oh, no, I still have copays.
No.
Yeah, no.
It doesn't. It actually covers almost nothing. I'm actually thinking of switching to having no health care.
Yeah, because it's cheaper to not go through insurance for a lot of healthcare costs.